UNICEF ranks New Zealand in the bottom half of countries when it comes to tackling child poverty. So a coalition of child advocacy groups here is looking to the Netherlands for ways to get more success without breaking the bank. Chair of Every Child Counts, Liz Gibbs, joins me now. Good morning.
Good morning.
Do we have a child poverty crisis in New Zealand?
We do. Over 237,000 children live in relative poverty in New Zealand. That's 22% of our total population of children under the age of 16. And that's, we think, unacceptable.
There's another crisis as well, though. Your report reveals a crisis in monitoring child poverty. How important is it to measure the situation?
Yeah, it's really important. All of us as taxpayers contribute towards public policy. And of course, it's important that we know, as taxpayers, as parents, as families, communities, and as government officials, how effective those policies are. So it's critical that we've got really clear benchmarks, measurements and outcomes and reporting so we can continually improve those policies to make sure that children are getting the best possible start.
Obviously,
and we don't have those in place at present.
Obviously, this is in the news already. Jacinda Ardern was challenging Paula Bennett in Parliament, saying we're not measuring the situation of our children, our young people who are in poverty clearly enough. And there was a bit of argy-bargy there. The government says, look, we're trying to fix the problem, not measure it. So where does it lie in terms of balancing those two tasks?
Yeah, Every Child Counts would strongly advocate that we both need to fix the problem and also need to measure it. We have got some fantastic initiatives in place, things like the parenting education programs that Plunkett and Hippie and many other organisations run, but they're not universal services. And what is interesting about the Netherlands reports is that they have a very integrated system of delivery which is very child-centric. So the whole community basically wraps around children, and that includes business, communities, education, parents, and take a responsibility for the best outcomes for children.
Can you unpackage the Netherlands report a bit for us? How comparable are we to that country?
Yeah, very interesting. In the OECD rankings, I'm sad to say that New Zealand ranks 29th out of 30 countries for health outcomes for children, whereas the Netherlands ranks 5th. This is why last year, when Every Child Counts conducted its Infometrics report, 1,000 Days to Get It Right for Children, we highlighted through that report the big discrepancy between New Zealand and the Netherlands, and also, tragically, the cost to New Zealand of not getting it right for children. Currently, we estimate that to be costing us around $6 billion per year in poor outcomes for children, poor educational outcomes, and lower productivity, as well as social indicators. So clearly we were very interested to see what the Netherlands was doing differently. They are doing a range of activities, including very integrated parenting education, early childhood education that's financed both by parents, families, businesses and government, primary schools that provide pre- and post-school support for children, which enables parents to be back in the workplace, which is also helpful because that increases the economic value that contributes to the whole of the welfare system as well. So it becomes a virtuous circle of improvement for children and families, making it possible for families to have a reasonable standard of living. What's also interesting is that services are often co-located in community hubs, which means again that it's much easier for families to access those community services. And also there is a unique indicator number for every child and youth in the Netherlands. So they're tracked right through all services,
which comes back to monitoring and
to slip
information.
through the gaps. Yeah. The opportunity for children to slip through the gaps is far less.
Okay. Look, there's talk of a Polynesian time bomb. That's what Anton Blank from Ririki called it. The fact that Māori and Pacific children are going to bear the brunt of child poverty in New Zealand, and we're going to see more of these children in the future. Is that a specific issue that we need to concertedly put money, time and energy towards?
Absolutely. We need to do that urgently for Māori and Pacifica children. 27% of those children in the poverty indicators in this country are Māori and 40% are Pacifica. Not only that, but the population growth to 2026 for both of those sections of our community is going to increase. So potentially that problem is going to increase significantly if we don't urgently address that and put Māori and Pacifica children at the centre of effective government policy.
All right, Liz Gibbs, Chair of Every Child Counts. Thanks for joining Breakfast this morning.
Thank you.